sit here. Oh, well, I can't see her.
Y'all, we're gonna go ahead and get started.
It came straight.
Hey, you.
Hi.
All right, I'm gonna yell louder. We're gonna go ahead and get started. Yay. Since no one heard me the first time, I'll lead with a chair. Chair, I kick it off to you.
Thank you.
When you're ready, you can.
So welcome everyone to our August meeting. Today we have two significant things that we are going to be doing. The first, we are going to be reviewing and voting on the new Community Advisory Committee members. Everyone should have received a link with the document that had the membership recommendations and some information about those folks. So please refer to that. And then we will also be having our first discussion on our next set of key performance indicators. And as a reminder, the KPIs that we currently have are set to expire at the end of this calendar year, which is why we need to have this conversation about what we want our work to look like going forward. I think this is a really excellent opportunity to make sure that the KPIs, the key performance indicators, measure what we want them to be measuring that's important to our community, important to our county, and that we start thinking about the goals that we want that are attached to those key performance indicators. The goal with the KPI is twofold: is to track and measure our homelessness response system for its effectiveness over time, and to inform our investment decisions as we face declining resources. In a word, it's really about the accountability that we have to the public. I want to appreciate the HRS team for getting this work off the ground, given our current set of measures expire at the end of this year. I also want to recognize that they started this effort in the right way, tapping the expertise within the data and evaluation team of the Homeless Services Department, and vetting initial proposals with the implementation committee for HRS and the Community Advisory Committee. That's exactly how this governance structure is supposed to work. So as you remember, Jillian sent out via email, this presentation and discussion today is the phase 1 of this work, reaching agreement on what we measure. Phase 2 is going to happen next, and that focuses on the goals that we want to set around some of these indicators. That's the harder part of the discussion, because any goals need to align with program and resources. If they don't align with those, it is the job of this body to carry that message back to our commission and council. My hope is that with this new comprehensive set of KPIs, we as elected officials and the folks on this committee will be armed with even better information to take back to our elected bodies and drive conversations toward what we need to improve outcomes. So as usual, this meeting will be recorded and will be posted online for everyone who cannot attend and would like to review later. So I want to go ahead and turn it over to Robin for our first order of business, which is discussion and vote on the new members of the Community Advisory Committee.
Thank you. I just want to do a check-in to make sure that Counselor Zimmerman can hear us in the meeting.
He can hear us, but he can hear you, but we are still working on room audio and video.
Okay, great. Thank you.
Bane of my existence.
He can hear, and he can hear people closest to that computer.
Yeah.
Okay. I just want to say that the county's IT security is working super well. So I'm sure everyone that is happening. Happy to join you all to recommend 3 community members, including a business owner, a member of Portland Street Response, staff member, and a provider with experience in youth and domestic violence and sexual assault services to the Homelessness Response System Community Advisory Committee. Today, I'll be recommending Kate Wood, Tiffany Thomas Geis, and Heather Whiteman. So first of all, Kate Wood is an owner or co-owner of 3 businesses, 2 brick and mortar in the city of Portland, 1 in Sunnyside, 1 in the Fremont neighborhood. Kate is a graduate of the University of Oregon. She's worked as a reporter and in communications and on various campaigns that she's passionate about. Kate stood out for her understanding of the street level impacts of homelessness as a business owner and a local employer, and also for her strong interest in addressing not just the symptoms of homelessness in our community, but the root causes through better connections to housing, income, and employment. Tiffany has managed adult mental health, dual diagnosis treatment facilities. She has worked with Black and African American youth with justice involvement as a part of their life journey, and is currently working in the DV and sexual assault continuum um, as a director for a community provider, and she brings lived experience of homelessness. Tiffany's recommended for her breadth of experience working with youth, as well as focus sector, a focus sector experience with housing and homelessness. Our third recommendee is Heather. Heather is the community health supervisor for Portland Street Response Aftercare Team. In this role, she supervises peers, community health workers who provide strength-based, person-centered support to individuals in crisis. Her team focuses on stabilization, resource coordination, and recovery support for people referred by PSR mental health providers, and she brings lived experience of homelessness. Just to be clear, Heather was recommended as a PSR representative for her breadth of knowledge of that system and organizational positionality to bring a wide lens to the work. And all of these three community members voiced strong interest in these issues for many reasons, including their own personal experience, as well as a desire to contribute to the hard and necessary conversations about housing and homelessness in our community. So if these three are appointed, they'll join 11 current members of the Community Advisory Committee. And I would just like to point out that we have two members of our Community Advisory Committee here, Drew Grabham and Nikki Dolan, who's one of our chairs. And all of the SOC members received a de-identified roster that shows as a part of the memo that includes information on our Community Advisory Committee, their expertise, their civic connections, their intersecting identity, and their geographic representation. 2 spots remain. We're still seeking a representative from North Portland. We have one interested community member that's been identified and we've met with. And we extended a recruitment to our partners from the East County cities in a recent meeting to help with recruitment outside of Gresham or Portland. So we're also working on that. And should I stop there for now or go finish with the?
We should finish.
Okay, great. So just by way of a quick update on the current CAC work, our Community Advisory Committee has continued to be engaged in policy tables pertaining to the HRAP. You'll see today they've also participated in the work on the KPIs. They've given feedback on the potential KPIs that were presented, and their feedback will be a part of the presentation today. And we're very happy to report that the last quarterly report for the HRAP, both our implementation committee and our CAC participated in a co-feedback session, and that's been a goal of ours. We just haven't been able to sync up everybody's both schedules and our approach to that. So we're really happy to report that those two committees are working hand in hand at the same time. So hearing each other's feedback in real time, and that's an important piece, both for transparency and sort of synergy of the two groups. The CAC next will focus on building their relationship with the implementation committee with the support of our COO, Chris Neal, and Mike Jordan. And they're working on a year 1 report. The CAC has been in action for for the past year, and they'll forward that both to the implementation committee and the steering and oversight committee. They would like to host PPB's chat team and their behavioral health unit, as well as Portland Fire and Rescue's Hope team for some conversation sessions with the CAC, sort of leaning into their role of surfacing emerging trends, and then also sharing that back with both the implementation committee and the steering and oversight committee. And before I hand it back to the chair for the conversation, as was shared in the memo, the process for selecting a first responder started back in April after the SOC gave us direction that they would like to see a first responder on the CAC. Over the past several months, I've worked with the Portland Solutions Director, Sky, who's here in the room, and I met with they recommended 5 different Portland Street Response staff. I was able to meet with 2 of them, and really it's about a time capacity and scheduling issue. I also met with 2 officers from Portland Police Bureau and 1 member of Portland Fire and Rescue. And again, Heather was chosen both for her positionality, her experience, and her breadth of knowledge of the connectivity of those first responding sectors. I guess that I'll say that. And while we do have someone in mind to fill the seat from someone from North Portland, we're open to additional direction from this committee. And again, we're also connecting with the sheriff's office to be a part of sort of those conversation sessions with our CAC. And with that, I'll hand it back to the chair.
Thank you so much.
Thank you.
I appreciate all the work that went into this and all the time that you spent with different folks that really following up on some of the things that we were in the sort of mentioned. So
Thank you.
The way we want that community represented. So thank you for that. I'll open the floor to discussion. I will say I've read the bios and the information about the candidates. I support the selection and I'll be able to do that. I also want to note that based on a conversation Jillian had with some of us via email, I do support broadening the implementation committee to include more public safety representation, which goes hand in hand with the discussion today. I think that there was this need of like, how do we make sure that the people who are really doing the work of implementing the plan that we have around the HRAP are able to feed into this process in the most impactful way. And I think the implementation committee is that right level. And I think that having more first responder and public safety representation at that table is going to do with the broader conversations that are happening there. All right, so with that, I will open it up to discussion, and as we have discussion, I also welcome a motion. They will move forward with these recommendations. Yes.
Very qualified individual and all of the community advisory committee. I appreciate you hearing me out in April with my concern. I'll be voting no. And the primary reason is that we have a lot of lived experience, and I appreciate you bringing the Portland Street Response representative, of which I would vote yes. As a whole, though, with the other 2 members, we're continuing down the very heavily weighted for lived experience for those that are on the street. And I'm still focused on adding those that are affected through PTSD. I have firefighters that are quitting, police officers that are suffering trauma. I would like more public safety representation so we see the humanitarian crisis that's unfolding. Again, overall, great. But with 16 positions and now assigning the proposed 15th and 16th to North Portland and Eastside, of which I agree 100%, it leaves us with an unqualified roster for public safety responders that are being affected in a material way. So to just bring up, I appreciate this, the incremental step. It's just not far enough with the staff that you're going to be working with. Okay.
Can I respond?
Sure.
I just want to say Kate Wood is in direct response to very clear feedback that a small business owner be added. So that was from,
Qualified.
yeah.
All wonderful additions, but it's not missing the total makeup that I'm looking for with a more diverse group of individuals and voices of those that are being harmed because of our crisis that's unfolding on the street.
Thank you so much, Mayor Wilson. And I just want to, again, share back with the group that part of the response of the CAC and what I've spoken about with our co-chairs is really holding those direct dialogues and building relationships to see how, at least on a quarterly basis, we can be hearing from street level responders and PPB, Portland Fire and Rescue, and other folks that are in that first responder sector that you're speaking of, so that we are hearing from them regularly and folding that into what the CAC will be bringing to both the implementation committee and the steering and oversight committee. So we're really going to work hard to be responsive to your request. And as you all have direction of folks that you want the CAC and us as staff to be speaking to directly or having into our meetings. And I just want to remind you, and it's going to sound funny, I don't mean it to be funny, but this space is yours. They're also available to come to these meetings and be surfacing some of the experience that you're referring to. I would say I feel absolutely I just feel so much gratitude to our CAC members and the experience that they bring, as I'm hearing from you as well. They work so closely with both Portland Police Bureau, our sheriffs, and the teams that have been built within those agencies, that I do feel that some of the issues are coming, but again, those direct conversation sessions I think are going to add to what they're considering in terms of their recommendations. So thank you. Thanks so much. Sorry.
Thank you.
Excuse me, thank you. And thank you for the work to get us here. I think, for me, Mayor, I don't think that we continue to hold up seats because of the inability of folks to serve. And so I will be voting yes on this slate today. And I appreciate the work that's been done and the work to find other ways to ensure that it's not just the CAC that we're hearing from first responders to be responding to that need to make sure that their voice is incorporated. Let's make sure that as whatever processes are set up, that we're articulating when and where those folks are engaged, that we continue to show the mayor. And I think Eric may have some similar feedback that, or Councilor Zimmerman, that we make sure that we're showing them where we're doing that work that you're talking about.
Absolutely.
Thank you.
So I agree with Mayor Wilson that I think the seat at the table is much different than the occasional contribution that can be had. When you're at the table, it's a much different part of inclusion that gets included into that discussion and conversation. I am going to be voting yes. I agree with what you just said, Commissioner. I literally was sitting here thinking, we've been working on a first responder for quite some time. I mean, I've heard it over and over and over again. We can't continue to hold positions open. I would be more than willing and more than happy to be a part of the discussion as we go forward. Once someone is identified, at that point, what's the solution? What can we do to address that part that's missing, as part of the discussion? I truly believe our first responders see a lot of this stuff every single day. They've got something to add on an ongoing basis. But I agree, we can't keep holding the positions open, and I'm more than happy to have that discussion. Once we can identify someone, how can we remedy the situation that we currently are talking about?
Thank you. And any other, do we have Councilor Zimmer online?
He hasn't raised his hand. Councilor Zimmerman, do you want to?
And you don't need to, I just wanted to make sure.
Yeah.
I should see this.
Yeah.
Yeah, I will weigh in. Thank you. I appreciate that. I think that with respect to some of the first responder questions, it gets to me that there are some different types of first responder experiences that I think we will hear more about based on who is at the table. I'm always cautious if I think about who chat is responding with, or if I think about who PSR is responding with, those clients are different than perhaps some of the folks that police are responding with. And we often will lump these groups together when we talk about representing on boards like this. And I think it would be probably well worth the mayor's effort, instead of interviewing a bunch of folks from the different agencies. I think that the two mayors on this body could consider just assigning it, right? These are paramilitary organizations. They take orders. And if you find an officer or firefighter who you think is best to represent a certain perspective on the community board, that you assign that as part of their duties. I think we get into this idea that everybody's a volunteer, but some folks do this for work. And so I do think that a police and a fire perspective would round out the PSR perspective in that first responder category. So I want to offer that up. If we think it's important, then we make assignments. And the police are really good at following assignments. Fire is really good at following assignments, but we've got to carve that out of their day instead of adding it to the many, many things. So I would just say that I do share. One, I wanted to say I'm very happy about having the business owner on the nomination. And then I was hoping that maybe in the future, if we can also, when we go through these, just a kind of a reminder of what are we seeking from the community board? What kind of discussions are they having? How are they engaging on these KPIs, and how does that funnel up to us so that we understand the 3 different boards and the different roles? I think it's helpful when we take a look at these names. So thanks, Chair.
All right, thank you, Counselor. And I will say, we have run into this issue before with the local public safety coordinating council or
Yeah.
LIPSIC. And the desire to have first responders, the desire to have public safety representative, and the time constraints that really makes that difficult. And so I think that we really need to figure out how we can make sure that we're creating spaces that work for those voices and getting the perspective into the conversations that we're having in a way that matches their availability and schedule. And I mean, the idea of like assigning people to it, we can talk to law enforcement agencies or public safety about that. I know that there's a lot of capacity issues right now from conversations that are happening. So I think that the work to like figure out how we can be creating space that works in the best way if somebody isn't able to make the commitment to be on a standing committee for something like that. So
Chairman, quickly.
Really quickly.
Okay, so I thank you so much for that. I just wanted to again raise that was one of the big issues that we ran into in this part of the recruitment, and I would be really remiss if I didn't extend thanks to Sky and her team, Stephanie, April, and all of them for working with me really diligently over the last 4 months to try to identify folks for whom this worked. And we truly talked to 8 different people over the with several other names being surfaced. So thank you so much for that partnership, and thank you so much for the conversation. I really appreciate it.
thank you. I would like to ask for a motion to support the community advisory committee additional members.
So
All right, we have a motion and a second. We have a vote for the members. We can start, Laura, let's start down with you. And I think we do 1 and 2s. Or 1.
That is if you want to feel for consensus first, and then the actual vote comes from the voting members, the 5 electeds in the room.
Okay, so we can try to see, thank you for the reminder.
That's okay.
We'll do consensus.
Hold on, we've never done this since I've been here, so tell me what the numbers.
Oh, we did it back in April with the 1, 2, and 3. You want to go?
1 is full support, no exceptions. 2 is I support it, even though I would like, some additional tweaks, but I'm cool with moving.
Yeah.
I'm fine with moving forward. 3 is I oppose.
Okay,
Yeah.
thank you.
Yeah.
And then thank you for the reminder that we'll do consensus first and then we'll go.
Great, thank you.
And are we doing that on the group of 3 or on the
Consensus is everyone.
one?
One.
3,
2.
Yeah.
1.
And Counselor Zimmerman just said 2.
Okay, so with that, then, well, I'll ask for, and thank you everyone for that conversation, and then we'll have a vote of the voting members, which are the elected members of this. Yes. Yes. Oh, you're voting now, so that was kind of to gain consensus, so I hear from the voice of the voting members of that, yes, so.
Yes.
Zimmerman?
Yes.
All right, thank you very much for that, and we welcome
our new members for the community advisory committee.
Thank you.
All right.
Thanks, everyone. Appreciate that. And we'll be in touch. I will reach out directly to both of the mayors as instructed, and we'll be, I think we can develop some shared direction. So I'll just say that. Okay, fantastic. All right, Chair, we're ready to shift to the main event. So before I hand it off to Lori and Ryan, I'm going to repeat for the umpteenth time today and via email that this represents the phase one of our work, agreeing on what we are measuring at a systems level. We have some slides up front that help to define key performance indicators versus the numerous sub-indicators and other activities that exist all the way down to the contract level. Ideally, we come to complete consensus today because one can always be hopeful, or at a minimum, enough consensus so that the HRS team in partnership with a number of folks can continue to move this effort forward. The chair and I together will be sort of listening and feeling for the consensus in the room, and we can have a vote at any time or a series of votes depending on the reaction in the room. And then, so once again, once we agree on the what we are measuring, we will move into phase two, goal setting, which is probably that's the harder part of this process. But I do, if we, by some miracle, do reach broad consensus in the room, I do have a little exercise in my back pocket where we can get going on the goal setting portion of that. So with that, I'm going to hand it off to Ryan Dybert, who you know well, and to Lori Kelly, our planning and evaluation manager who oversees our data team. Thank you.
Good morning, everybody. Really glad to be here. My name is Ryan Dybert. I use he, him pronouns. I'm the deputy director here at the Homelessness Response System. Really glad to be here with Lori. Would you like to introduce yourself?
Absolutely. Lori Kelly, I use she, her pronouns. I'm the planning and evaluation manager, as mentioned, at the Homeless Services Department.
Absolutely. We move to the next slide.
Mhm.
So we're here this morning to talk about the next evolution of the key performance indicators for the Homelessness Response Action Plan. That's one of the clearly defined roles that this committee in particular holds, is to set the key performance indicators for the plan, annually revisit those key performance indicators. Are they the right indicators that we want to be tracking? Are we making the progress that we want to be seeing? Very glad to be bringing this conversation forward today, very much in line with what was imagined for this committee in the budget agreement and the structure of the Homelessness Response Action Plan. So just to remind you, within the existing Homelessness Response Action Plan, we have 4 key performance indicators. We've talked a lot about them in this committee. We've talked even more about them in our Community Advisory Committee and in our Implementation Committee, where we're monitoring those 4 key performance measures really closely on a quarterly basis and thinking about the programmatic shifts that we need to make to move the needle on those 4. We've talked about some of the limitations of those measures as well. So for instance, on measure 1, we're looking at sheltering or housing an additional 2,700 folks who were previously unsheltered across our system. It's a hard number, a specific number. We're making excellent progress toward that goal. As of this last quarterly report, we're 94% of the way there, with 2 quarters yet to go. So we'll probably exceed that goal coming into next quarter. The difficulty, though, with that measure is it's telling us that we're doing a good job of sheltering and housing folks, but it doesn't help us fully understand, is that moving the needle on net for how many folks are experiencing homelessness across our community? You've identified that as a concern, asked for supplemental data. So this exercise is about taking those indicators that we have based on the kind of feedback that you've provided, our Community Advisory Committee and our Implementation Committee have provided, help evolve those key performance indicators so that you have the set of measures across our entire system that help you understand, on balance, is our system doing what we want to see it doing? So we're also bringing this work forward right now in alignment with developing the revised HRAP 2.0, as we've been calling it, the evolution of those action items into this next phase. and the reorganization of those action items into looking at inflow to homelessness, outflow from homelessness, and then safety off the streets while folks are experiencing homelessness. So you'll see some reflection of that in how we're structuring these recommended KPIs. I'll also say just process-wise, we've been really, really lucky to draw on the depth of expertise that our partners at the services department have in collecting and measuring these system level indicators. They've also been able to work closely with their colleagues across other city and county departments to think about the range of data that we have to work with and how we can effectively measure it. Go to the next slide. Just setting some like broader context around what a KPI is in relation, how we're thinking about key performance indicators in relation to other pieces of data that we're going to monitor on an ongoing basis. So and you can refer to the helpful notes right up here at the front of the table, which covers this slide and will be just up there throughout. But key performance indicators really getting at what do we need to know whether we're succeeding or not. I think of this as the needle. So if we're asking the question, are we moving the needle? These KPIs are those highest level system indicators. Are we making the shifts that we want to see? We'll also talk about a whole set of sub-indicators that we hope to follow. So accompanying any of those key performance indicators would be a set of sub-indicators that tell us more about why. If the needle is moving, why? What do we know from our policy interventions and from the performance of our programs? What do we know about why that needle might be moving? And then want to also just call out that we track a ton of program level metrics as well, mostly through our departments, through the folks at Portland Solutions, through Homeless Services Department, to actually on a contract by contract level measure, are these providers producing the kinds of outcomes that we believe that we've contracted? So again, sort of three levels: key performance indicators that look at a broad systems level, those sub-indicators that help us understand why those key performance indicators are moving, and then the program metrics that we track to look at individual provider performance. Okay, next slide. And then just to kind of note how those all fit together in terms of the policy making and then investment and program interventions below that. So we set these key performance indicators and some associated goals so that as a system, we can say, we want to move in these directions. We want to see our needles moving this way. That turns into a set of strategies that as policymakers, you're investing in through the annual budget process and passing down to the departments to deliver through programs and sets of contracted services. So those all have to work together in alignment, connected to the policy and budget choices that we're making here at a local level, that we're seeing at a state level, and that wrap up with our federal resources as well. All right, so that was just setting the framework for what we're going to talk about. And then I turned it over to Lori because she's super smarter and can walk you through all of the great thinking that they brought to us.
Thank you, Ryan. That means a lot coming from you. So stepping in the next slide, I wanted to ground everyone first in what these KPIs are trying to measure. These were developed to measure the performance of the whole homeless response system. So these are system level KPIs, not department specific KPIs. Although in some cases, some of the KPIs will be tethered, or certain departments will be responsible to the strategies to achieve it. These are also heavily weighted towards homeless system and housing production goals, because this isn't a systemic poverty action plan. This is a homeless response action plan. However, as we review suggested KPIs, we might want to consider whether there are other multi-sector KPIs that should be considered here, more behavioral health, more health system KPIs. Next slide. So these were developed in partnership with multiple departments. While we used research and grounding in existing metrics to make sure things were measurable, that we were leveraging existing data. We also did reach out to partners across the systems to find out what they're currently measuring and what the tools of their trade were to really understand how they were doing. These KPIs were also selected with strategic alignment in mind. They were selected with the idea of system-wide impact, meaning a KPI ideally is speaking to both inflow and outflow and system-wide impact whenever it can. And then it's also thinking at a very high level. So we've been moving through this process for a little bit now. We have presented this to the Community Advisory Committee and to the Implementation Committee. So a little bit of what's happened is here. And as I'll describe, we first presented the Implementation Committee some KPIs that you may or may not see right now, and I'll tell you why. We heard during our first round that there were too many metrics at too many levels. So many of the indicators that we had on there, the KPIs were moved to sub-indicators because they were in the end actually process or program metrics that we needed to understand why we were getting to where we were going to go, but they weren't the high level KPIs we wanted. As a result, some were moved down to the sub-indicator level. Other ones were moved up because we consider them to be a system level KPI. We also heard that we needed more metrics to look at acuity that for the homelessness population. As a result, chronic homelessness was added to the KPI level. Many people don't realize this, but chronic homelessness isn't just a time homelessness metric. It also includes chronic health conditions, which speak to the vulnerability of long-time homelessness. We also added a placeholder metric for health care metrics, and we'll talk a little bit of why that's a placeholder right now and not a specific metric in a minute. We also heard that we needed to measure the time of experience of homelessness and the time from services to resolving homelessness. That is also spoken to with the chronic homelessness metric. So next slide.
You want to just move on? Or actually, let's speak to domicile unknown real quick.
Oh, yes.
Yeah.
So we also spoke to the Community Advisory Committee. They asked us to look beyond eviction data a little bit more clearly. And we will be working to think about what sub-indicators might speak to late rent payments, to unemployment. We will also be measuring a look at acuity in sub-indicators a little bit more. Could unmet healthcare needs or need for services and supports be really good sub-indicators? And then finally, domicile unknown, as Jillian mentioned. So many people spoke to having to put a KPI in there that really speaks to one of the most devastating impacts of homelessness, domicile unknown, or frankly, dying on the streets. One of the problems with that metric is that it isn't measured very frequently and it is still developed and often can be a little messy. So we're working with our public health partners to really figure out what is the appropriate domicile unknown metric to put in here that's both responsive and can be regularly updated. So without further ado, I'm about to jump into the metrics, but I wanted to walk you through how they're measured. There are indicators across the continuum. Some metrics actually speak to inflow and outflow simultaneously. Other ones are going to specifically speak to inflow or safety on and off the streets, or outflow. To be more specific, what is affecting inflow into homelessness? What are we doing to support people while they're homeless? And then what is affecting people's resolution of homelessness to permanent housing? Okay. So the next one, here we have indicators across the continuum. So I'm going to jump into these now. I know I speak quickly and I also know there's a lot of details here. We're going to ask that people don't ask questions till we're done, just because there's a lot of details and we want to get through it so you have time for a meaningful discussion. So the first indicator, understanding that we are looking to reduce and eliminate homelessness, is frankly people experiencing homelessness from our by name list. You've all seen this before. It's on our dashboard already and should be fairly familiar with it. The second one, which is across the indicators, is people who have returned to homelessness. This is an indicator of people who have returned to homelessness after being housed in a housing program. We recognize that everyone coming from homelessness is likely coming from a housing situation. This is specifically people who have received an intervention, moved into permanent housing, are now back into experiencing homelessness. The third one's a little bit different. It is an inventory of affordable housing for 100 extremely low-income renter households. And this would be disaggregated by unit type. So we would be looking at it in the family system for single adults, and then ideally disaggregating this in other ways to understand disability, access, and so on and so forth. I also want to call out at this point in time that all these indicators were selected because they can be disaggregated to look at it from an equity perspective. We can look at race, ethnicity, age, and so forth to really understand how these indicators are performing. The final one is health integration metrics. So this is currently TBD. One of the reasons this is to be determined is because we are midway through an analysis with HealthShare on some metadata. I believe we just got the results set yesterday, which is really exciting, and we'll be looking at it. Our hope is that when looking at this information, strategies will be suggested on how to meet homeless people with the greatest medical acuity, in particular thinking about behavioral health, and those strategies would indicate KPIs that would follow. Okay, and these are the metrics for specific inflow, safety on and off the streets, and outflow. The first one people should be familiar with as well. It's people who became homeless. So this is again one of our dashboard metrics that you've seen from our Built for Zero data. The second one there, number 6, are people living without a lease agreement. This one can really make people pause. And so I want to explain, this is effectively our doubled up metric. And this came from an analysis that the Benioff Institute did, that 49% of people who enter homelessness enter it from doubling up or from not holding a lease. So this is not necessarily indicating a particular strategy, but it is a really good indicator of what we're seeing on the inflow side and what we need to keep track of. If this number meaningfully increases, we can expect that we might see an inflow in homelessness. It could also suggest a strategy, but this is a performance indicator that many other cities have embraced, along with some strategies to approach it. LA, for example, is using this to really keep an eye on what is the inflow looking like and how is poverty looking. The other larger percentage of people who are entering homeless are generally people who are recently evicted. So their eviction judgments or filings as the other inflow metric. And next, what are we doing to support people on the street? So the metrics that we would be looking on this are people experiencing unsheltered homelessness, people experiencing chronic homelessness, and then this domicile unknown metric that I already spoke to. Finally, we have outflow. There are 2 outflow metrics here, and they might seem really similar at first, so I want to explain that number 10 is sort of the companion to number 5. We see people flowing into the by name list. We see people flowing out of the by name list. They might flow out of the by name list for a multitude of reasons other than being stably housed. They could leave the area. They can find other ways of resolving their homelessness. They could end up in a long-term institution. So this is really the counterbalance for people who became homelessness. But then there's also specifically people exited homelessness to housing. So we need to track that as well, because that's really a success of our housing efforts. And then finally, these are all not, actually I take it back. These are not all the sub-indicators. There will be many sub-indicators as we develop our strategies. These are some of the sub-indicators that have been moved from our initial KPIs, and they are critical to look at. I just want to call out that sub-indicators are not less important. In fact, they are really the critical things we track as we move through. And if KPIs are high level, sub-indicators are grounded in strategies and resources. And if we add benchmarks that are specific to them, they are generally attached to programmatic resources that we will be applying to make sure that we can meet our goals. And so as we're looking at the KPIs, we're going to want to know how we're doing, but we're always going to want to ask why we're doing that way. And these sub-indicators are one of many that will let us know where we're going to be. So with that, I'll turn it over to conversation. Some of the questions we asked the other 2 committees were, are these too many or too little? What's missing? And then other things were, what kinds of sub-indicators might you think about? Although we're not having a sub-indicator conversation today. So really to think about, are you thinking about a sub-indicator or a KPI when you're suggesting this? So we can file that away for the next conversation.
Thank you so much, Ryan and Laura. Really appreciate all the work that went into this. I think it was really helpful to get the feedback and the response from both the implementation committees and the community advisory committees. I mean, that is how the system is supposed to work in our conversations about process and positions being what's happening at those tables. So I want to just be clear what we're looking for today, but the goal is to see if we can get some consensus around moving for some of these KPIs. And so that would be, those things that are focused on slides 10 and 11.
Exactly. I also want to remind you that we're not talking about how much we're measuring on any of these, specifically the KPIs, just for everyone here. Yeah, absolutely. Sorry about that. No, sorry to jump in. I just wanted to make sure if we're setting a KPI, we're not necessarily setting a benchmark attached to that KPI. So if we're saying number of people homeless, we're not saying we'll drop the number of people homeless by a certain percentage yet. That's part 2 of the conversation.
Yes. that is going to be a very important piece, and that's actually, I mean, I think that's going to be the crux of what we need to be moving towards. I think having consensus on the things that
The
we are
what?
going to measure, the
Mhm.
what today is important. This is not, and the phase 2 piece is really, I think, where we are setting the goals for us as a community, as a county, as cities. So, we'll have that. So thank you for framing what we are and we aren't doing today. So with that, and for conversation, if folks wanna, I see some name tags up already. I also wanted to encourage people, if you see indicators that you feel that you support or support about, if it's all of them or a few of them or whatever, please also lift that up, because I think that will help me get a sense of where folks are and if they are coming to consensus on things. So with that, I will turn it over to Commissioner Singleton.
Thank you. Thank you both and all the other folks on the team who have got this work here. I'm going to immediately not follow direction. Focus on only the 2 slides. I know that's shocking for everybody. I just wanted to name on slide 8. I would be interested to know where we think we're going to get data beyond eviction. I feel like any current places that we have to understand that is a smaller sample size than the actual population.
Yep.
That might be impacted by, right? We're not going to know everybody who has a late payment. I want to make sure we're not measuring late payments that are an agency's fault as opposed to the tenant, right? So there's just a lot in that I would want us to talk more about. And then in the sub indicators, and I totally support a conversation about domicile unknown. But I do think it's important to name that we also know that people experiencing homelessness have much shorter life expectancies, and we see lots of people who pass away soon after getting back into housing. And not that we need to necessarily, I just want to name that because I think that's an important component of what it's actually like, of the impact on health for people who have experienced homelessness even once they're housed.
Yep.
Now I'll follow directions. So on slide 11, just wanted to check on the by name list. Do we currently, youth are included in the by name list?
Yes.
Correct? Are we doing any tracking about youth who essentially age into the adult system?
Not explicitly in that by name list flow, although you will see that we have an all adult list that's different than this, but not on here. It does receive people aging out of the youth system and into that, so that could be a sub indicator.
Okay, yeah, I think that could be interesting and tell us some more of that upstream intervention. And then on just some of the sub indicators, I wanted to verify that when you talk about housing retention on slide 12 at 6, 12, and 24 months, that with rapid rehousing, it is post subsidy, correct?
Mhm.
Okay. And so I feel like they'll be reported separately in PSH and RRH, like we're not gonna combine them.
They already are on our
Okay.
dashboard, actually. Yeah.
Perfect. Total number of individuals in housing programs disaggregated by housing program type. Can you say more about that?
Yes. So it's effectively what you just described. So actually, if you look at our dashboard right now, so
Got it.
it's going to be in PSH or rapid rehousing.
Okay.
Broken out.
Okay.
Yeah.
Super. Okay, thank you.
Yeah.
And then number of individuals exiting homelessness prevention programs to permanent housing. I'm struggling with that one a little bit and how it's not the same as the inflow, people receiving homelessness.
Yeah, there's some
prevention.
that really could have been system wide or kind of like stretch around the continuum for one another term, and it probably belongs in system wide. There's also some issues with needing to break out, and we can work on this a little bit, the people in programs versus people in prevention programs. So I think that's a good
Okay.
call out. Yeah.
It would be great to figure out just because, or if it's the same measure that we use the same language, so we're not.
Yeah.
Thank you.
Thank you. We'll go to Mayor Wilson, and then Director Matthews, and
Thank you, Chair. So the things that I'll always be bringing clarity of focus and mission is the bias towards action. And so I want to know what these numbers are. And I want to start with measure 1, go back to the top side. And I think I might be going out of order, Jillian. Actually, it's, the beginning slide. It's the actual measure, 1, 2, and 3 of the overall comprehensive track program.
So our current
Right,
indicators.
yeah. And I know you mentioned, or I think, Lori, you had said somebody that's the next conversation.
Yep.
So I just want to talk about, that's the area in which I'm going to really try and focus on is a hard number, not an
Yep.
activity base, but we started at 5,400. And that was what the A trap was based on. We said we wanted to reduce some shelter homelessness by 2,700. But now we're measuring the activity and it's just going up. And now we're faced with 7,518 people living on the street. So understand, I want a hard number with the focus in all my conversations with everybody that we bias towards action. If we're not going south or down, if we're going north, the temperature in this room, in my hope, it is with the city, that it's just going up because we're going the wrong way, right? So I would hope, while that's the next conversation, let me just kind of put that down as the placeholder while we talk about that very specific outcome. And now going back to the specific request at this meeting right now, it was really slides 11 and 10, 11 and 12. First of all, I wanted to say, great job, Julian. It's not an easy task. You're going through with taking KPIs. Everybody owns a KPI, and when you reduce and remove, there's always consternation, but good job. The one I did like that was added is domicile unknown. I come to these meetings with a story of who came into my office that particular day, of explaining who died. It's the same reason why on the Community Action Committee, I wanted a public safety person to show that these are humans, these are our neighbors, and the why. I would love to try and drill down, and I'm happy to help flesh out the domicile unknown. I get reports of fatalities, homicides. 1 to 2% of those living on the street represent our population. They represent 50% or so of our homicides, gun violence, traumatic situations. So it's a real metric that I believe we can measure and put it at the top here. Really, it adds that, again, bias to action approach. And then, yeah, I know. But I also want to try and go beyond this. I would hope that at this meeting, and a placeholder as well, thank you for the back and forth on emails. When you came up with length to stay and you presented that data 90 days ago, that was such good information. I would like to make it more ForceCon than Oceanlight, where we're getting it at least every month and we're lean. Is how is our system performing? How is our shelter system performing?
Right.
Where are we experiencing gaps? Hence the overnight and housing. We have 2 strike teams that sit set up that are meeting every week. I would like to see, and I noted to you on that, you said, let's talk about it. I want to know, rapid exit mindset is what Anna had noted. We're following the National Mindset and Homelessness, and let's hew to it because we all know. And rapid exit mindset and diversion. Just looking at Houston's number, we talked about 64% diversion in there, which is not housing. It's just all the things that we can do. I think we should measure it and focus on the 90-day rapid exit mindset. I would like to see that specific data, health of the system. 2017, we went with best information available, 23 days. We're at 77. I want that 77 listed, and then all of us fight to get that going south. Because we know we have a system that's we're unsticking the system. The chronic one, yes, that was great to have. How many people are in the system over a year? When I look at the contracts for the HSD and the JLHS, I see TBD for how long the length of stay should be. We should not have TBD. Let's come up with what we think it should be. Making sure the system's trauma informed. Absolutely, everything we do. We're not going to exit anybody ever to the street. So that's one metric I would like to see is what's the health of the current sheltering system? How long do we have these people in an emergency shelter, emergency being the focus? There are a couple, and then the subcategories is bed utilization. That's another sub indicator that we have every day that's listed. Engagement, making sure that the program provider has an engagement program that people are engaging in, and if not, why? And again, it ties to that KPI of what is our length of stay average of the system right now, and we posted at the top of this meeting, and we talked about 4 or 5 key metrics, vital metrics that we all agree, and we'll talk about in the next meeting, about what's the system doing right now, right here? And do we agree that we accept it or we don't? And if we don't, health and human services, public space, public safety, right of way and infrastructure, we can bring our collective efforts together to then fine tune those indicators. I think we have all the makings of a great system. But Portland's here, you know, we have right of way infrastructure, public space, public safety. We can really toggle some of these switches on and off to help the system, okay? So I hope I was clear. Domicile good, rapid exit mindset with, I want to know exactly the health of the system. How many days are we having these people in an emergency situation? I'd like to see that added, okay?
So, length of stay can be measured any day, anytime. Data is easy to pull like that with the new way that HSD has improved HMIS. Length of stay is also a very good example that it is tied to the budget and policy decisions of our elected bodies. You need houses to place people in, and you need rent assistance. And our system is not funded on balance.
And that's what we're doing
So-
in Portland. We have 2 incident command meetings. Thank you, Joe. Thank you to Metro. Thank you to the county and we have hundreds, if not thousands of empty rooms right now. And so it's creating, I agree with you. Homelessness is a housing problem, but we have so much underutilized assets. CCC has 400 empty rooms today, both subsidized and market rate. In some cases, $500. We need the linkage of that. And that's what will help provide linkage to all of our homeless service providers. You're right, housing, but we also need to have additional shelters. So we're asking these people from a public space standpoint, it's time to come inside. And yeah.
I just quickly on length of stay, I think it's a bigger, like that to me is a sub indicator of length of time homeless, right? Like there's something about us, if we're going to reach functional zero, it includes brief, right? And I don't know that we have a measure here that's about brief. So that's just something for us to look at. And I think that's a sub indicator of that.
And I think that's where when I look at Houston, they have a clear measure. 64% don't even come into shelter. They don't even come into shelter. They're just safe and appropriate diversion, the number 2 item on the National Alliance to End Homelessness. I really love that sense of urgency that they have. And I really want to try and apply that to the system.
Thank you, Mayor. Director Matthews.
Okay, I keep putting my tag up and down.
Oh, and I want to say in the room, Counselor Zimmerman, you will be next. I apologize. I see your hand here.
Oh, thanks.
Yeah.
Okay, so I just want to make a comment on the sub indicator. Rapid rehousing and sort of, I guess it will fall under the outflow. And I see right now we're looking at the housing units that are regulated and affordable for those households that are less than 30% of AMI. I just would, if we hadn't talked about this, if we can include a sub indicator that measures those rapid rehousing efforts that we have deemed successful because they met the 24-month mark. But the short-term rental assistance has exhausted, and these individuals were put in 60% units and are facing eviction.
Yep.
Because they're in a situation where, you know, it's very difficult to maintain folks in housing units, and we aren't able to meet that coverage ratio for these tax credit units.
Absolutely.
So that's a big one. And so we have a lot of vacancies, but those vacancies don't quite fit the 30% model with subsidy.
Yeah. I've looked at the vacancies for CCC, so to bridge back, Mayor, what you're calling diversion is what Ivory is calling rapid rehousing, and pointing out that, yet including CCC, there are a ton of vacancies at the 60% AMI level. People can't afford it. We need more 30% units, hence the focus on 30% here.
Thank you, Director Matthews. Counselor Zimmerman.
Hi, thanks. I appreciated what Commissioner Singleton, you were mentioning about the youth flow, right, from youth to adult. And I'm recognized that Lori said not to get to the numbers. And so I want to just articulate it a little bit. I'm prioritizing youth numbers as a pretty important goal when I think about our KPIs, because at least historically in my career, a lot of our a lot of our youth who are homeless were homeless for reasons that had to do with their family relationship. And if to not beat around the bush, is basically LGBT kids who couldn't live at home anymore. So I guess I'm looking at that as if there's any inflow, kind of like we did a decade plus ago with veterans, if there's any inflow that we can target specifically and reduce, that would be an important KPI for me. And I think it's, I guess I'm just laying that out there as a priority. Switching a little bit, and I'll also say, Lori, it might be worth hearing maybe what we do track and what we don't. And I might be unfamiliar with the new terms or how we're tracking to Shannon and mine's point, but it'd be a great conversation moving forward. The other thing I'm looking at in terms of the by name list, I'm hoping that we can move to a point where now that we've got a by name list, I am interested, similar to my comments earlier about not trying to lump everybody together, which often becomes the case, but I would love to be able to have an assessment that says, this person and their one major thing, not their 20, but the major impediment by the assessment of whomever the right professional is to make that assessment. This one thing is the major impediment to them being successfully homed. And I think of that as there are some folks who mental illness is the most critical thing that we could address. For others, it's drug use and addiction could be the most critical. And others, it's family level poverty in terms of just the job and the wages are not covering what we needed to cover. I am looking to be able to have more conversation and more targeted approaches based on different populations. But the reason I think that this is important is this gets to some of the ongoing conversation that I think that our two governments need to have, in the county and the city, about really painting the picture for the state feds that there's a significant population that if we are able to say, we need the mental health hospital to have more seats than just judicial related seats, people who are there because of judicial reasons instead of because they need care reasons alone. I think we've got to be able to segment that out and show that one thing. This one thing is the greatest impediment to a more thriving, prosperous life in Portland. And if we're able to do that, then I think we can get folks into the right spot, or at least say here's how under capacity we are in terms of what we really need. And the big challenge over the last few years is that I continue to feel like the populations get kind of muddied up. And so we aren't working in as targeted of ways as I would like to be able to say that we are. So that was my points on this. Thanks for the KPIs.
Thank you so much, Counselor. I really appreciate that. I will say, when we were doing the first version of the HRAP, the youth piece was really important in terms of inflow. And I appreciate you bringing up the LGBTQI youth community. And we also saw the foster care system being a huge piece of that as well. So I would be interested in indicators that look at those things, or sub-indicators, I should say, that look at those pieces as well. And then we're going over to CEO Statlander. And I would love your thoughts on some of the things. I know you and I have had conversations about the right level of care or the level of need. And I know this, this impacts housing and how people are able to be successful in house, once they're housed, if they don't have the right supports, and like the needs that we have for the state to really lean in on the highest level of acuity care. So I want to hear your comment and also the response to Council.
Yeah, so kudos to the team for both a great proposal to get us started, but also this is the kind of conversation I was hoping that this group would have in the leadership and governance capacity. So thanks for framing it up this way. I think kind of first, before I'll get into those comments, there are people smarter than me about this, but I think one of the things we struggled with in the first set of KPIs was making sure, like, much of this is about improving the system and about public accountability. And so our first set of KPIs might have helped us identify places where we got stuck in the operations of the system, but didn't tell the story about what we were doing and how we were moving. So just, maybe you already have, but make sure someone runs it through that lens. Are these the things that we can feel confident tells the story about our performance publicly?
Yep.
I do think that service matching and behavioral health capacity is going to be really critical. I think that probably threading it through multiple things and not just in the healthcare integration section will be really important. I think like sneak preview of what we're seeing in the data is that the population that looks to us like unsheltered homelessness, much higher degree of conditions for those that we could match of opioid use disorder, stimulant use disorder, or an untreated psychosis diagnosis. So that's different from the whole population. We know we need to do a better job at that kind of service matching for folks that are unsheltered. And so that can inform our strategies going forward. Super excited to have deeper conversation about that. Commissioner Zimmerman, I think your point about capacity at the state level is really important. So, I'll suggest a straight out capacity measure around that under that health integration section, because though we can control and influence some of that at this local level, we also just have to be really clear with our state partners about what capacity needs are for our community in the Tri-County area. I also just saw some data that about somewhere between 20 and 30% of the service utilization of those high acuity things in our region. So Providence Inpatient Psychiatric Services, Unity, come from out of our region. So like we are the hub for both the people that we need to take care of, but also for folks in the rest of the state. So I think being clear about that's important. And then just a little comment around I appreciate your point, Jillian, on the inventory and the less than 30% of AMI. I think thinking about vacant days is probably important, because it's not just about how many units we have, but then about how quickly we're able to turn them over and get through. And I've heard that comment about vacant units from more than just Simplicity. I've heard that from other behavioral health and health partners in my world.
Okay, thank you. I have Mayor Snowball, Mayor Wilson, and then Director Matthews.
Just really seconding what everybody else has said. Great work. This is, I know to distill something down to something like this, there's a lot of work in the background that gets us to where we are today. I will say that number one under the indicators, for me, doesn't work for an indicator. In this, relegated to kind of this list and specifically in the inflows. I mean, because it's a number. I think this is the overarching work that we're doing. It literally is how many people are experiencing homelessness. I mean, that should be the number that overarches everything that we do. We start with that, and then everything else becomes the indicator of why people are actually inflowing into the system. I really like the other three. They're representative of what's coming in. Now, what Mindy was just referencing in the healthcare integration one, that's going to be interesting. I think it's critical because ultimately understanding the magnitude of the problem with our mental health challenges that we don't have the resources for. And if you're in healthcare, I used to be a healthcare executive. Mental health services in our country are just so inadequate. I don't need to say that too long for folks to understand. So inadequate. I mean, it's actually embarrassing as a country that we can't get this right. So understanding kind of what contributes to our folks who are struggling with mental health and end up either houseless, homeless, or unsheltered is a critical piece of it. But then also exiting from our healthcare systems, hospitals and healthcare systems in the region have actually done work to try and mitigate that by investing in actual housing so that they could because length of stay in hospitals is very expensive. And the quicker hospitals can get them into lower acuity care is going to be better for them and the greater community. And so understanding, how healthcare is contributing, to the challenge, I think is critical. But what that metric is going to be is also going to be something that's an interesting discussion and discourse. But again, I think 2, 3, and 4 actually measuring the inflows. It's how are we doing here. And then, of course, some of the sub indicators I look through there, and the eviction judgments. Those are the things that again are contributing, to the challenges of inflow. But the number one, I look at that and I think I'm not quite sure that should be there. I think that should just be the overarching number that lets us know whether or not, regardless of which part of the indicators across the continuum we're talking about, everything we're doing is to reduce that number.
Thank you so much, Mayor Stovall. Mayor Wilson.
So, first of all, CEO Stadlander, I think that's the first time I've ever said your last name. Thank you for being formal, and then you went right back to Mindy. Mindy had two key points: the pressure on our behavioral health system, and addiction system, and the populations that are utilizing that. But it goes beyond that. It's our public safety system that's overwhelmed. Our systems are overwhelmed. Everything is. The point you made about connecting people with services. So one of the key items there is number 11, Brian. And you and I spoke on email regarding this one. Jillian, and I believe somewhat of a consensus, we at our incident command meeting every week begin with reunifications. So in the last 2 weeks, we've reunified 15 people with their families and loved ones around the nation. I would like to have that indicator with county and city being very clear, because for every person we reunite from the street where there's a high acuity behavioral health and addiction, it takes the pressure off of your system at $300, $500, $700, where TSA is helping us. And if we're able to connect with loved ones, we're working with Unity as well, trying to say, if we can bring in a relative, help them get back home, we will cover it. So I'd like to really add that as a specific indicator, 11. But if you want to make it a subpopulation where we talk every meeting about it, because we have flexible funds for the homeless service providers, Portland's doing it. Let's talk about people we house right then, right there, and how we house them with their loved ones, because that's housing. It doesn't always mean a door and four walls in Portland. It means connection to social networks. So let's add that one in there, okay? And celebrate every single time and every single person.
Yeah, that sounds like it could be a sub-indicator, right?
And it already
Yeah.
is.
Yeah.
So to be clear,
Yeah.
it already is captured as a sub-indicator under number 11, but the city, and we're working on the county side of the equation, you now have what's called a program inside HMIS specific to reunification funds. So we will be able to track that accordingly, and the city's set up in the system. And so
Great.
to do that.
Great.
I just want to say on that.
Okay.
So that's always been a common practice.
Yes.
And I think it's important to make sure all providers are well
Yes.
aware of that. But I also think we have to be tracking retention,
Yes.
even if it's phone call follow-ups, because that's how we used to do it. And I think that part is critical, right? Because you can reunify, but it doesn't mean that's a stable housing placement for the person long-term. So I think we have to be able to evaluate that.
And I would layer on to that, and then I'll shut up. Pulling the data in the context of returns to homelessness.
Right.
Those who were reunified, how many are returning?
Yeah. So
So,
let me just add some nuance to that. Going off of Phoenix, they have a 10% overall reunification rate with an 85% retention. And so it's really a low cost, fast way to provide support for our community. In Boston, it's 8% with an over 90% retention. So I just want to say, everybody, let's take advantage of those low hanging opportunities to save lives and help the system, take the pressure off the system.
Thank you so much. So I have Director Matthews and Commissioner Singleton.
I'm just curious, what is a 30% unit? And the reason why, number 3, inventory number, indicator number 3, is the inventory of affordable homes, which I'm assuming is a 30% unit. And I just ask because, in my world, HUD has not funded 30% units in over 3 decades. And they were public housing, which is why we moved away, from that model.
yeah, and
So-
this is where I need PHB in the room. This is something that they, or do you want to?
No,
you go.
you're probably going exactly where I need to go.
Yeah.
This is a recommended PHB.
Yes, this is a recommended PHB metric, and we know that this is the affordability people need.
Yeah, that's a
Right.
ability they need.
And I know-
There is no thing, there's
Yeah.
no such thing as a physical unit.
Yeah.
Right.
That is a 30% unit.
That's be project-based voucher, right?
We do have through the investments that we made with the Portland Housing Bond and the Metro Housing Bond, those did develop regulated at 30%
Yeah.
units as a subset of the regulated affordable portfolio. So we do have a number of those, and I think that's what PHP is proposing to track is across our continuum, which of those are regulated at 30%. As far as I know, almost all of those are locally funded through our Portland Housing Bond or Metro.
They're local. They're tied, and they have project-based vouchers tied to them. Okay, we just need to make sure, like, that's a very small number. We already know the answer to that.
It needs
So
to be
there,
bigger.
nobody else can add to this. So why is that?
Well, it's a part of the reason regional housing production strategy requirement is to look at that level and number of units. I don't know that there's a solve for the how to build them, but they have to. That's a part of that new regional housing needs analysis and production strategy. So there is a way to track it, and that relates back to the state. But I think there's the bigger question of.
I'll also just add, I know Helmi from PHB has said she's really looking at different ways to subsidize in the interim, but then looking at recapitalization of different buildings that would actually lead to a different funding model for. A lot of these units. So that's a longer, to Commissioner Singleton's point, that's a longer term project, but I think we're also looking at some interim strategies too. So it would be new, basically.
Okay,
Yeah.
okay.
How do you buy down 60% units? Also something Helmy is chewing on. But why don't we pull, we're going to have a follow-up with PHB. We just weren't able to have it before this meeting today. Why don't we pull you into that meeting?
Okay.
Ivory.
Thank you. Thank you.
I did want to clarify, be in any housing.
Yeah, I'm like.
Production meeting.
Fair.
This is helpful, especially as we are looking at local solutions, knowing federally, we're not going to be getting the resources at the levels that we need, like to help us to drive, like, do we need to invest further in local housing funds? I would say yes. So, so this is, I think this is going to help us track the and show. So thank you.
Okay.
So
I did want to clarify too, by the way, I apologize. I interrupted you twice now and I apologize. My favorite thing to do. No. I did want to clarify that we are working with Helmi that we have a way to track not just the current existing units, but in a regular way, because the state reports on them annually. That's not a very responsive way. So I do want to make sure that it's clear that we're working on a way to track what's coming online. And then we have a couple just like tickler ways to make sure that we're updating that number regularly. Yeah.
all right, thank you. Commissioner Sims.
Thank you. A couple of things. One, I don't think this is happening yet, so I'd love to know what you need from electeds to help us get there. But people who are going into jail, we should be getting folks on the by name list, whether they're entering jail or hospitals or all these other sites that we know there's outflow to homelessness. And I think that's just something we have to make happen, whether it's particularly when it's county controlled entities. The next piece was just to talk a little bit about what Mindy and Mayor Stovall raised. I think it's also not just capacity at the hospital and Council Zimmerman, but it's also a ton of missing levels of care in the state. And so I would love to see an advocacy agenda that addresses, we don't have intensive, tell me where you can get intensive outpatient treatment. You can't, right? And so how, Mindy's making sounds. So it's yes and then the other thing that y'all raised around the mental health crisis care and that we're kind of the hub for the state. Previous data also told us that about transitional recovery housing, and I would be interested to know, do we still have folks from across Oregon that are in our transitional recovery housing? And to be clear, it's not that they shouldn't get into them, but I do think we're reaching a critical point where there's a conversation with the state about figuring out how to fund these types of services in some other locations of the state so that we are able to actually utilize what we need, because we don't have enough beds for what we need here. And we know that care is better if somebody is closer to home and where they're going to go. I can't tell you how difficult it has been for me in the past to try and house somebody in other parts of Oregon and actually provide the retention services that they need. And so it's a disservice to them for there not to be additional services in other parts of the state. And then on Oh, we already talked about reunification tracking. I think that was it for now. Thank you.
Right. Thank you. So, Ms. Forrest, I did have, well, I'm gonna let you go because you have not had a chance to talk more, and then I have a couple questions, so.
I've kind of been digesting over here of what it is I particularly want to say, and I'm probably getting beyond into the weeds of where we don't need to be right now, but I can't help but think about it in that looking at our key performance indicators for 2 and 4, the return to houselessness and the healthcare integration system, I think what we're going to find is we're going to get stuck in a cyclical loop on those 2 points because our system is so pressed. And so I don't have a good solution, or I can't think right now through what that would look like, but just really to the points that have already been brought up a little bit around that healthcare integration. And when we're talking about the degree of acuity that we're seeing on the streets with folks, the degree of unmet healthcare needs, that discussion around a behavioral health continuum that needs to be tied to that. Like, I think what you're going to find is that you're going to get people into shelter. Their length of stay will be short. They won't be there very long. They'll be back on the streets. And then we won't have these other things in place because they're systemically, they are in such a large level to the state level, to the point that I think we need to have that degree of buy-in and recognition of where we're at in order to keep that cycle from not going. And I don't know what that looks like. I just can see it. I see it, and I don't see us getting off of it. And so I'm wondering, I'm just kind of curious of where do we, as we have this conversation of moving folks off the street into shelters, how are we really hitting 4 hard? Like, because I think that's where we need to be at. And you know, to Mayor Stovall's point around sort of thinking about how all of these systems are creatively navigating healthcare systems in particular, and me thinking from my own experience in the healthcare system, you know, our healthcare system has created a number of internal programs to address just that, trying to get folks from an acute state to a post-acute state, keeping them housed at a hospital system, which is not our responsibility to do, but we are investing in putting money there because it means that they're not going back to their previous disposition and on the street. And it also gives us time to try to bridge them somewhere else. And so, and that's working. It's a small scale, but I think that's working. And so how do we sort of, you know, if it's connecting with our healthcare systems, understanding how those are utilizing, looking into our other shelter systems that are sort of functioning in that same degree, TPI, you know, I just think that we just need, I feel like we just need to really figure out how we get there, because I'm worried that we're going to do this and all we're going to do is go back and forth between inflow and outflow over and over and over. It's like, we're not saying with permanent supported housing, the same barriers are happening there. Folks are not equipped to take care of the degree of behavioral health acuity that's being presented in this permanent supported housing settings. And then people are not able to successfully stay housed because they're not getting their needs met in that setting, and they're not equipped to take care of the acuity that's going on. So I do think we just need to hit on where are folks going, and then where are we putting money and investment into supported housing? Do they need to have more wrap services? Who's providing care to the folks that are going into the setting? You know, what things are our healthcare systems or other systems uniquely doing that has been working to try to address the breakdown in our broader community system? And then how do we get the state and, you know, like that state level buy-in on investing into that, because that is the broader continuum I really think we need. And it's a conversation I think is really going to take a long time to get there. And I think we need to have it simultaneous to removing people off the street immediately, because we're going to be right back in the same place, like in a short span of time where, you know, we're just not making it happen.
I agree that, you know, for me, being on the ground in this everyday, like the preservation and the retention of our existing need is suffocating. And so that's a real statement. Yeah.
And I would argue that if people with high acuity are not successful in PSH, then it's not PSH.
Yeah.
Because that's who this is designed, PSH is designed for.
Yeah.
And so I would love to know at some point, what is what is the actual services that are in PSH, right? So when I was running Join, us having PSH meant somebody got a housing case manager. That's not PSH, right? But my mobile permanent supportive housing team had addiction services, mental health services in the person's apartment, right? That's PSH.
Yeah.
And so I feel like we've set agencies up to do something that they don't have the staffing structure to do. And then because I keep hearing this, like people are too acute for PSH. That's literally the population that's designed for. So it means we're not actually doing PSH and we need to fix that.
Exactly, and that's my, and we're not investing where it needs to be, so like there's something happening there, and so
Yeah.
to me, then it's like we need to do an evaluation of what pathways are folks currently engaging in housing, what is failing there? Where do we need to sort of like, they already exist, we need to be putting funds there and supporting those structures.
Yeah.
Are they appropriately staffed? Do they, like exactly to your point, otherwise that is the pathway. And if not that, then like hands in the air, I don't know where people are supposed to go.
Yeah.
And I'm also hearing now more and more too, are like high acuity community-based programs are not taking people because they're too acute, but they're not acute enough for the psychiatric hospital, but they're too acute for ACT level of care. Like that's happening right now too. And why is that happening? It's probably happening because of bandwidth as well. I don't know, but I just, here it is. I'm talking about this. That's the cycle that we're in. That is the literal pattern we're in, and that is not breaking. And this will not change unless we actually focus on understanding what is not working with the systems that we have that were designed to literally help our highest acute patients or clients, excuse me. And why are those not working? And where I think like we need to be talking about that and supporting that. Because they're there already, but they're not functioning the way they used to. They don't have the capacity to do what they have done for us in the past. So that's my two.
Yeah, thank you so much. I really appreciate the discussion. That is something here. I think how we talk about this healthcare integrated metric and the indicators and sub-indicators that we're going to go are going to be really important. So I'm curious about the timeline based on the work that's happening with health share in that or
Yeah, so Mindy and I communicated last night. I was literally jumped up and down with joy when Mindy said, okay, we're ready. So I was like, yay, because I was expecting a mid-September timeline. So we're actually ahead of schedule. Let's celebrate that for a moment. So Mindy and team are going to come in and specifically first meet with HSD and BHD together in one room so we understand what the data says, what it means, how it can be applied. And then Mindy is going to do a little tour with elected officials so that there is shared understanding about what it means and what it says, again, how we can use it. And then from there, we're going to work diligently with HealthShare to figure out what this metric should be, all of the appropriate sub-indicators. And we'll need to socialize that with everyone. But the big picture goal timeline here is y'all to have sort of this work done ready for y'all by October 15th, which is an aggressive timeline, but that's the ideal time where y'all approve the KPIs, what we're measuring, and any associated goals with these to then refer them out to the City Council and the Board of Commissioners. That's a really aggressive timeline. So we're going to try and make it.
Okay, thank you. Yep, that's right.
And I do think just to again, to contextualize it within how this body functions relative to the other components of the oversight for the homelessness response system. This is an area where, Laura, to talk about those cycles, we're trying to get you KPIs that help you understand at a system level, how much is that occurring? So that this body can say, hey, we've got a whole implementation committee and a community advisory committee who are in the weeds on this every day. We need them to focus on this and help bring us some deeper perspective and some pathways to a different set of outcomes, like recommendations for different sets of outcomes. So as you consider these KPIs kind of in their collective, the question is, are they giving you the kinds of measures that let you know this is healthy or this isn't quite healthy as a system, and therefore we need you to explore and get deeper on these other things. So you get to use the expertise that we bring in with the other components to help solve the how do we fix it.
Thank you. So it sounds like what I've been hearing today is that
I haven't heard anybody who's disagreed with any of these that are being proposed. The ask is to add some more sub indicators across, and I know that you guys have been tracking those, which is great. I think we've had a really good conversation about this. So it feels like that we've got some consensus around the slides 10 and 11 with the ask to add additional sub indicators, which we're not voting on today, but I think that we would like to have the full list of sub indicators brought back to this group so we get to see the totality of that. I don't know if you said this already, Jillian, as we're talking about the phase 2 and putting the goals in place to the KPIs that we decide on, we are expecting that work to be done, including by this group, October 15th. So we're not going to be, we want to get the KPIs and then we want to move right into the deep conversation about the goals, which I will say for those of us who are elected members, like that means going back to our respective bodies and, checking in with them about what we think are the right goals to be measuring and thinking about from your positions as community members and organizational leaders. What does that look like and what do those goals that seem right? So want to just give some insight into the next steps. But with that being said, I would ask, and I guess my ask is that knowing that we have kind of the TBD around the healthcare integration metric and the domicile unknown metric, like we will be okay, I think, with the placeholder unless folks feel it's important to pull those out until we do get those information. I'm fine either way, but what I would like to see is if we can do the consensus vote around accepting the KPIs as they're listed on slides 10 and 11, knowing that we're going to have healthcare integration, domicile no, and then addition of some of the other sub indicators that were promised.
So I just want to ask before we do that, there was a document with definitions that is related to this. And
Yes.
I shockingly have some feedback about those. If we make this decision today, is there still room to share that feedback so we can feel on the same page about those?
I also think they may critically in some ways map to how much we're going to measure. So if we decide to go for rate of change or a specific number, that might also impact the definition.
Yeah. Okay, I'll just send that to y'all.
Okay,
That's
great.
Thank you. Okay, so with that, we'll see again the 1, 2, or 3 for consensus on supporting the KPIs as listed on slides 11. Laura, what? Just okay.
I'm going to say 2, and it's because we talked about adding something around length of homelessness that isn't currently on the slides. So I would be in support with that addition.
Did we discuss that as a KPI or as a sub indicator? Do you remember?
I felt you delivered it as a sub indicator, Commissioner, which is again something we can pull now and all day, every day. Contract level requirements, that kind of stuff is where that currently resides.
There was a lot of things that were, the length of stay for shelter.
Yeah.
Like a lot of those things that were brought forward as things that people want to see as sub indicators, and that's why I asked for
Oh, okay, so let me clarify.
it's
I
tied.
think there's sub indicators of a larger KPI around length of homelessness. I think length of stay is different than,
Oh,
right?
okay.
Because part of what we should be doing as a system is reducing the length of homelessness, the average length of homelessness.
This was about the brief when you were talking about
Yes.
like the brief.
Yeah.
Okay.
We had suggested the number of people experiencing chronic homelessness as like a placeholder for that, because length of stay is very complicated. Length of homelessness, excuse me. Are you estimating something different than the number of people experiencing chronic homelessness as like an indicator of that?
As it's
Oh, wait,
embedded
it's
in that.
Yeah, because again, coming back to if our goal is the functional 0, there's nothing right now measuring brief, and not everybody is
Okay.
gonna hit the chronic homeless definition. So it feels like we're
Okay.
missing a ability to be tracking that and see if our system is functioning, that we're decreasing length of stay over time.
So
Sorry, length of homelessness.
This actually might be a feasibility issue, unlike all the other ones, and I'll explain why. And it's something we can nuance, but I do want to explain the nuance of it, which is where do we start? And I think one of the things is with, with cyclical issues of homelessness, do you start if somebody was housed for 3 months, are they still homeless as a chronically homeless individual? So there's a little of that nuance to get through. And then there's also a little bit of nuance of first indication of homelessness in our system is not the same as first experience of homelessness. So
I totally
Yes,
appreciate
yeah,
that, and
yeah.
it's part of the national definition,
Yes,
so
I
let's
agree.
talk to our national partners,
Agreed.
but I think having a placeholder that just says length of homelessness, and we can work on some of the nuance, and then I can be in full support of slide 11.
And you would put it here,
Ugh.
or no? Lori, what would be here or?
I was saying in slide 11 in outflow.
Oh, okay.
Oh, okay.
Okay. Okay, cool. Thanks for that clear direction.
Okay, so are you saying you're gonna work on one definition or definitions?
I'm saying they're gonna work.
Sorry, there's this list of definitions. And
Oh.
Commissioner Singleton has feedback on this list of definitions. And then what we're talking about here is adding like a number 12 or maybe 13 at this point, KPI that's talking about length of
Homelessness.
Gotcha,
Yes.
okay.
And then some sub indicators come back to length of stay in shelter or whatever.
Yep.
Some of those might be.
Yep.
Okay, but yes, and they are gonna deliver back to us a comprehensive list of those sub indicators, and we're not voting on all of the sub indicators right now. Okay, great. So with those changes, the addition of like that number 13, so you're good with that?
Yes, no, I'm a one.
Okay, I'm a one.
But one, but with the caveat, is having a robust discussion on what our outcome expectations. Again, we started at 5,400. I expected it to be in the goal at 2,700, not measuring that activity, but a clear outcome. We promised shelter beds. I want to know what that number is and where we're at. And then to Commissioner Singleton's point, some measurements that I've talked about already. So I just want to make sure we're having a clear agreement. And if we reset the numbers, we reset, but then we bias action, and those are the numbers we all agree to hit.
Yep.
And we'll definitely have a deeper conversation as we move towards the goals for
Yeah.
the 11th. All right, Mayor Stovall.
I'm a 1.2.
Right.
1.2, yeah, so it's complete agreement with the caveats. I mean, I agree exactly what was just saying. So I'm there, it's just 0.2, just lets you know, kind of, we got a little work to do. Yeah.
And
Oh, yeah, always be evolving.
Ann Zimmerman,
Two. Did I hear two?
I think that was a 2, right?
That was a 2.
Thank you.
Okay, thank you for that. As we, it feels like we have consensus, so I'll ask the elected to our voting members of the SOC to go ahead and vote. So Commissioner Singleton?
Yes.
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 All right, great. So thank you for that. I really appreciate the conversation exercise and to lift up something Mindy said earlier. I do think that this is like really a good use of our time and to really be focused on what we're all going to be driving to as a community. So I appreciate this conversation. So thank you for that. So I will, I think we're about to wrap up. I'll turn it over to staff to see if there's any last things that we need to talk about before I close this up.
Thank you, Chair. I want to acknowledge that Ivory emailed last night, would like 5 minutes to do some reporting in. However, before that, Ivory, I want to toss something out and y'all may freak out on me, but so we're going to go back, build out sub indicators, add this KPI, those sorts of things. I also would like, are y'all comfortable with us doing some goal setting work to bring you some samples of what solid goals would look like around 3 of these KPIs, which for me, they're at the top of the list, which is 3, that inventory, 8, unsheltered homelessness, and 11, exits to housing. If we could do some initial work around that. And Mayor, I know you keep referring back to measure 1, because what I want the data team to weigh in on is sometimes you set a goal around a hard number, a ratio, a percentage, and they know how all the levers work. I do not. But I think it was perhaps a mistake to do a hard number for our existing measure one because it doesn't capture the dynamics of the system, right? The 5,400 number change, for example. So I want them to chew on that to make sure that whether it's a hard number, a percentage, a ratio, whatever the hell it is, like their recommendation on which approach we should take when we set a goal for a particular KPI. Does that make sense? Okay, okay. So we will get going on that as well and come back to y'all. With that, Ivory, you have the floor. You have the last word here. You have some things that you urgently wanted to report in on.
Yes, I have I had the next to the last word. Thank you, because I don't want to end on a bad note. Well, no, you did have, yeah. So I really appreciate you all giving me the opportunity to provide some update on where Home Forward currently stands as it relates to information we receive from the federal government that I think that is super important for this body because it directly impacts the work that we're talking about, and Home Forward being one of the largest housing authorities and the largest housing provider, public housing provider in the state. You know, these resources are super critical to the work that we do here. Just, you know, as you all know, Home Forward assists over 18,000 households each year, and the housing stability of these families is paramount. Meanwhile, Home Forward is navigating a period of significant uncertainty with competing priorities and unknown federal resources ahead. So as you all know, roughly 70% of our funding comes from federal sources, making us highly sensitive to federal appropriation decisions and policy shifts. We continue to monitor and advocate for the federal budget process, but we know that any reduction in funding, even flat funding, will have a significant impact on our core programs, especially as operating and housing costs continue to rise. In June, I shared with this body some of the significant challenges we were already facing in providing ongoing assistance to families we support. The first challenge I shared concerns approximately 300 mixed immigration status households we currently serve. You know, as you know, for years, Home Forward has used an alternative rent proration policy that allowed us to support an entire household, that regardless of immigration status, federal policy changes now require us to limit assistance only to eligible household members. This change will create a significant increase in rent burden for these families and impact the housing stability will be profound. The second challenge is that an early sunset of the Emergency Housing Voucher Program, which I also shared with this group. This program supports nearly 400 households in our community, and the Emergency Housing Voucher Program specifically helped those individuals coming out of homelessness into what we thought would be a permanent housing situation. We were notified by HUD that this program is going to sunset. It was not reapproved in the new federal reauthorization of federal funds. And so we are working at paring down these families off of the program by fall of September of 2026 is when our funding ends for these 400 families. You know, when that happens, we will lose the critical resources to serve individuals and families who are experiencing or at risk of homelessness, and the impact will ripple throughout our community. Since June update, our situation has become even more pressing. We recently were notified this week that Home Forward is now in a shortfall status for our Housing Choice Voucher Program, which is our largest housing assistance program, and also for our Mainstream Voucher Program. The Mainstream program is a program where we provide rental assistance to homeless individuals who are at risk of becoming homeless, or those transitioning out of an institution setting like a hospital or nursing facility. So shortfall means that HUD has determined that our federal funding that we get, the 70% funding that we receive, will not cover existing housing subsidy obligations through the rest of the calendar year. I want to be clear in providing this information that working with the HUD shortfall team is fairly common for public housing. Unfortunately, it's fairly common for public housing authorities nationwide, particularly those who are living in high cost housing markets. For Home Forward, this issue stems from rising housing and utility costs that have exceeded HUD's annual funding projections, strong leasing in our special purpose voucher programs, and lower voucher turnover rates as families need longer terms of assistance to stabilize. So we don't have many families rolling off of the program like we have in the past. People are staying still because they just need that rental assistance for longer term. In fact, some of our neighboring housing authorities in the metro area are also in the shortfall. So due to the part of the region's increasing housing costs. So this is a very critical for us to know. Shortfall status could have immediate impacts. We are meeting with our HUD team to determine what cost saving measures Home Forward will implement. One known impact is that we are currently unable to issue any new housing choice vouchers or special purpose vouchers to families on our waiting list or from other referring systems of care. So right now we have been told by HUD that we can no longer participate in providing any more rental assistance to any program throughout our community. So I know, you know, we've issued a number of vouchers early on this year and also in the process I have notified our partners and also notifying those who have vouchers who have not leased up that we can no longer make good on those obligations. On one hand, shortfall status may also present opportunities such as additional funding because we do know that congressional appropriations each year, Congress does set aside a pot of money for shortfall funding. We're in line with every other housing authority across the country who's in shortfall funding, who's in a shortfall status. There are 3,200 housing authorities across the country, and Home Forward is just one of a couple hundreds of housing authorities who's in this space. Given these constraints and uncertainty we face in the coming fiscal year, we have made the difficult decision focus on preserving assistance for the households we currently already serve. This means we will not be pursuing additional BASH vouchers to house veterans that were made available early this summer, as these vouchers are funded for low cost and require additional financial resources at a time resources are scarce. In line with HUD shortfall requirements, we have also paused referrals to services of special purpose voucher program, including family unification, which we talked about earlier in this meeting. And these are individuals who are leaving an institution due to incarceration or leaving or people who have connected with their family through foster care or any other means of reunification. So we can't do the foster youth to independence program, and also, as I mentioned, the mainstream program. However, I want to assure our community partners, housing providers that rely on project-based voucher assistance that provide deep affordability to these units, that our project-based voucher contracts remain in place. So HUD does have a requirement under the federal law that we must continue to fund those project-based voucher contracts that we currently have. So I want to acknowledge that these decisions will have serious upstream and downstream impacts. They will be felt not just by the households directly affected, but by the homeless response system, by related systems of care, and by other community supports. We do not take this impact lightly. Home Forward, we're continually committed to working with our folk who represent us in the federal seats, our legislative delegation. We also currently continue to meet with our national trade organizations to reach across the aisle and hopefully get some of our folks who live in environments where they don't have the federal support around these resources to hopefully gain their support so that we can, have favorable results in when Congress makes their decision for the federal fiscal year budget in October.
I'm curious, and this I think is a much larger conversation, but who is working this problem and how can we show up to be support? I mean, I think one of the things for me with like mixed debt, do we need to figure out ways to swap vouchers with Arla and some of the ones that you have with mixed families? How do we figure this out and be a part of helping to solve this problem? And again, I don't think we can answer that today, but I just want to say for me, and I'm surprised Quinn's not kicking me. But like, we've got to figure out how we can realign our resources to help figure this out. I'd rather have staff who know how to do all this paperwork be offline of new placements if they need to come help to make sure that we don't have all of these families across EHV and that they just fall into homelessness because, so I just want to acknowledge that there's staffing expertise and capacity outside of Home Forward, and if there's a problem to work, I think we should get together and work that problem.
Thank you.
We have a meeting in the works already to boil this down and get our arms wrapped around it so that we can start problem solving. But I want to kick it over to Anna Plum. Did you want to add and layer in some context?
The specific of can we use RLF for some of this, that's already on a very small scale that is starting. Yeah.
So, yeah.
So, thank you, Director Matthews. I know this has, it's devastating to the families that are going to be impacted and the individuals who are impacted by this. And I know I'm sure it's devastating for you and your staff having to manage all of this. So I'm glad, I've known that there have been some conversations happening about like how can we help bridge the gap. So thank you, Commissioner Singleton, for bringing that up. But yes, we want to, we are going to have to be very creative, very nimble, and really be leaning into that, working together and working across our different silos of government organizations to really figure out how we're going to address that, knowing that we have huge impacts coming from the federal government. We also are facing resource constraints locally, and how do we continue to do this critical work? And so working together to solve those, I think, in this way. So thank you for bringing that forward.
And I just want to say too, from an economic standpoint, it's also super important that, we released about $200 million of housing assistance payments that goes directly to private landlords in this community. And so if there's any way that, I know sometimes our business community and our private community can also, have a say and help us lift this, to those decision makers in DC, that would certainly be good too.
Thank you. Thank you so much.
Mindy, did you have good news? Did I hear? Oh, that was a joke. Okay. Well, damn it then. Chair, wrap us up.
I just appreciate the work that we did today around the Community Advisory Committee and with the KPIs and our steps to move forward. Our next meeting is going to be on Friday, September 19th from 9:30 to 11:30. We will let everyone know about the location. Is there anything else? Ryan, I see you frantically gesturing.
Oh, sorry. I think Mindy did still want to hop in, but can do later, or?
I can do next month. I'll just signal that Medicaid is also under extremely significant challenges right now. This is prior to federal impacts and HR1 timelines. And so we're right in the middle of conversations with the Oregon Health Authority about rates right now. But kind of given the state budget challenges and increases in people utilizing services, there's a pretty significant gap. So I'll share more next month, but I think very much that it pertains, like these are interconnected systems. We are all trying to serve the same folks. If we make some of these decisions about where we prioritize in isolation from each other, we're going to inadvertently just cut different parts of the system. Yeah. Like protecting and preserving what's core.
Yeah. Thank you so much. All right, well, more to come on that next.
Sorry.
Again, Friday, September 19th from 9:30 to 11. We'll let folks know about the location. Thanks everyone for your time and your commitment, both today and every day. With that, we are adjourned.
Thank you, Chair.
I will end our Zoom subscription.
Yeah. I'm like. Yeah. Okay. So that's like the umbrella. Okay, and then we're not voting for each one of like that each one through under each getting confused. I was like, how many votes are we creating? It could be